Adela is in a rotten mood. She's just over a month old, and her fussy attitude is making it difficult for her audiologist to test her hearing. Janet Hansen is with Hennepin County Medical Center in Minneapolis, Minnesota. She didn't pass her first hearing test at birth, so she's here for a follow-up.
Here we go, it's okay.
Hearing loss occurs in 1 to 3 out of 1,000 babies born. The goal is to detect the problem in infants as early as possible.
The first year of life is so important for speech and language development for infants. They're doing a lot of listening well before they ever start talking, and so if they're not able to listen properly, that affects their output. Okay, that ear passed.
For Adela, the news is good. Like over 99% of all babies, her hearing is fine.
So I'm going to check your baby's hearing.
Devin, 10 days old, is in the midst of a nap. He's also here for a follow-up test.
I'm going to put a nice little soft earplug in the ear.
The test is called otoacoustic emissions testing. And while Devin sleeps, a soft probe, which contains speakers and a microphone, is placed in the ear canal. Tones are emitted, and if the ear has normal hearing, it creates an echo response, which the microphone picks up. Devin, however, does not pass the hearing test.
Both ears I'm not getting a pass on today, but sometimes that's caused by fluid built up in the ears.
Wax or other debris in the ear canal can be another reason babies don't pass the test.
The other thing it could be is he could have a hearing loss, and that's the whole reason we're doing all this hearing screening of all these babies.
For Devin, today's results mean more testing in the weeks to come. If permanent hearing loss is confirmed, hearing aids for infants as young as 1 month old are available. Lisa Black reporting.